Each of our lives is a story. We journey along a road of experiences and emotions, passing significant milestones along the way. When suddenly the road beneath our feet takes a sharp turn, breaking from what was once certain. Breast cancer causes this break. Perspective ruthlessly shifts. You and your loved ones see the road differently than before. However, we see the road has not ended. It continues on through new hills and new valleys. We know that life has done this before, curiously forcing us into foreign places and down roads that seemed impassable. Yet somehow, these challenges become fertile soil where seeds of strength, love, and resilience mature and grow strong. Remember, this is a road that has been traversed by thousands of women with full lives and loved ones, women whose dreams, whose lives were threatened by breast cancer. Breast is mostly made up of a collection of fat cells called adipose tissue. This tissue extends from the collarbone down to the underarm and across to the middle of the rib cage. There are also areas called lobes, lobules, and milk ducts. A healthy female breast is made up of 12 to 20 sections called lobes. Each of these lobes is made up of many smaller lobules, the gland that produces milk in nursing women. Both the lobes and lobules are connected by milk ducts, which act as stems or tubes to carry the milk to the nipple. Also within the adipose tissue is a network of ligaments, fibrous connective tissue, nerves, lymph vessels, lymph nodes, and blood vessels. The lymph system, which is part of the immune system, is a network of lymph vessels and lymph nodes running throughout the entire body. Similar to how the blood circulatory system distributes elements throughout the body, the lymph system transports disease-fighting cells and fluids. Clusters of bean-shaped lymph nodes are fixed in areas throughout the lymph system. They act as filters by carrying abnormal cells away from healthy tissue. In this chapter, we looked at the anatomy of the breast, focusing on the milk ducts, lobes, lobules, lymph system, and lymph nodes. Growth and spread of cancer can be difficult to grasp because cancer cell growth is fueled by usually healthy chemicals of the body. Medical professionals usually illustrate these chemicals with complex diagrams and scientific formulae. But let's simplify it. Circles are estrogen, squares are progesterone, and triangles are the HER2/neu gene. These three bodily chemicals can stimulate the growth of breast cancer tumors. To understand how these chemicals fuel cancer cell growth, we must first define something called a receptor. Here is a simplified illustration of a cancer cell. Notice the receptors for estrogen and progesterone. Think of the receptor as a mouth. When open, cancer cells can feed and grow. When blocked off, the same cells begin to starve. This particular cancer cell feeds off of the hormones estrogen and progesterone. Now this is a protein that is involved in cell growth, the HER2/neu protein. When a breast cell has more than 2 copies of this gene, the genes begin overproducing the HER2/neu protein. As a result, the affected cells rapidly grow and divide, forming a tumor. The tumor then begins to feed off of the HER2/neu protein. By identifying the cancer's unique receptors, your doctor can recommend effective treatment methods to block the receptors. Remember, inhibiting the cancer's food supply works to restrict the cancer's growth. Cancer. What caused it? What should I do now? How is breast cancer treated? How long will treatment take? What will it be like? Will I be okay? What about my family? When a lump or suspicious site in your breast is detected, it raises some serious questions. In this chapter, we are going to do our best to answer them. We will discuss what doctors know and do not know, how to react to your diagnosis, as well as how to understand it. What do scientists actually know about the causes of cancer? It's a difficult question. Cancer grows when a cell's DNA is damaged, which we discussed in Chapter 3. But why or how that DNA becomes damaged is still unknown. It could be genetic or environmental, or in most cases, a combination of the two. But most patients will never know exactly what caused their cancer. However, there are certain established risk factors that are associated with breast cancer. A family history with breast cancer, early menstruation, before age 12, late menopause, after 55, breast tissue that is more dense with lobular and ductal tissue relative to fatty tissue, non-cancerous cell abnormalities. These factors are genetic. They are not something you can control. 60 to 70% of people with breast cancer have no connection to them at all. And other people with risk factors will never develop cancer. We'll now cover the 5 stages of breast cancer and what to expect from each stage. Cancer is assessed by stages ranging from 0 to 4. Each stage represents a progression of the cancer. As the complexity of the cancer intensifies, so does the treatment required to fight it. Breast cancer is assigned to a stage based on where it began in the breast and how much of the breast and other parts of the body are affected by it. Remember, the stage of cancer is separate from the tumor grade, which we discussed in subchapter 3.2. We will also review the types of cancer, first covering the more common types of breast cancer, but also the unusual diagnoses like triple-negative breast cancer, inflammatory breast cancer, and cancer during pregnancy. Your responsibility, as discussed in Chapter 4, is to develop a support team of family or friends that will comfort and encourage you in this time. Earlier detection and more effective treatments. Many women diagnosed with breast cancer overcome the disease and go on to live healthy lives. It's important to understand the different types of treatment options available to you because you are an integral part of your decision-making team. Your medical team will advocate certain treatments, but they will also seek your input. They will recommend a plan based on stage of cancer and whether or not it has spread, type of cancer, and status of the estrogen, progesterone, or HER2/neu receptors found in the cancer cells, your age, health, and menstrual menopausal stage, and whether or not this is your first cancer treatment. In general, there are 5 treatment options, and most treatment plans include a combination of the following: surgery, radiation, hormone therapy, chemotherapy, targeted therapies. Some are local, targeting just the area around the tumor with surgery or radiation. Others are systemic, targeting your whole body with cancer-fighting agents, such as chemotherapy. Most women receive a combination of treatments, but each case is unique, and your medical team will work to find the most effective treatment for you. Even so, you may find yourself second-guessing their recommendations or suggested treatment plan. If you're hesitant for any reason, you should get the opinion of another doctor before beginning treatment. Your doctor will not mind if you want a second opinion. Some insurance plans even require it. Again, don't hesitate to ask your medical team questions. When it comes to getting a second opinion, you are your own best advocate. The first step down this new road is learning about your diagnosis and treatment options. On this journey requires you not only to be informed, but also to realize that you don't have to face this alone. Family, friends, and other breast cancer patients are your shield and safety net, carefully knit together to strengthen you. Alongside them, your triumphs over new hills will be celebrated, your struggles through new valleys endured. They can help you see past the shadows, reminding you that each step, each moment is precious. Leaning on them for emotional and physical needs isn't a sign of weakness, but rather a kind of healing for you and for them. In the world, who are wrestling with similar emotions, questions, decisions, experiences, and fears. You can ask questions and give answers. You can watch stories of hope and share your own. Beyond the shock of breast cancer, there is still life.